In this episode of Ask Dr. Zach,
I've always had back issues.
Text back pain, back with a vengeance.
Post-pregnancy,
We see her in
they've
various
come
rooms
back
with her
with a
child, and
vengeance.
she points to where her back hurts.
I am concerned about what will happen in the future because it seems to be getting worse.
and later,
Red and blue
I have
text. Ask
suffered
Dr.
from
Zach, who
post-traumatic
belongs
stress
sits in a
disorder
colorful
as
living room.
well as
Text.
depression
Mental
since
health,
about the age of
bedroom,
13. I was
PTSD.
sexually abused
She
by
leads a
3
yoga
trusted
class for
men in my
women of
home.
various ages.
then on the doctor's orders,
Ask
Doctor's
Dr.
orders.
Zach.
Fight
Doctor's
for your
orders.
rights.
Dr. Levine
Ageism
speaks
in
to
healthcare is a
camera.
fact. Healthcare professionals tend to be less aggressive in their treatment of older adults.
Call paramedics with a stretcher. Text 911. Emergency. Code blue.
In the
As a
ER,
person
I
is
deal
wheeled
with
to a
trauma and
hospital
life-threatening
corridor and to the
situations
emergency
every day.
room. Hospital rooms and homes. A life-saving
I've
activity.
seen it all.
Dr. Zach stands amidst it all.
I know firsthand that accurate medical advice can save lives. I'm Dr. Zach, and I'm passionate about empowering people to take control of their own health.
A white hospital corridor.
This is your
Monitor
chance to
walls.
ask me
Text
health
reads,
questions.
Ask Dr. Zach.
No question too big, no question too small.
In the studio, Dr. Zach Levine sits
The
at a
vast
desk
majority of
surrounded by
us
an
experience
audience.
back pain at some point in our lives. Most acute back pain is caused by a sudden injury to the muscles and ligaments that support the back. Other causes of sudden lower back pain include compression fractures, a ruptured or herniated disc, sciatica, and spinal stenosis. Let's take a look at the Blausen medical animation now for a more detailed perspective.
The spine consists of 33
Class and
vertebrae that
medical
protect the
animation of
spinal
human
cord and
body
provide
showing bone
stability to
structure,
the torso.
focusing on the spine.
The lower section of the spine is called the lumbar spine. This section of the spine is the most common site for back pain. Low back pain is generally classified as either mechanical or compressive. Mechanical pain is usually referred to as back strain due to its association with the movement of the spine. This type of pain is the result of injuries to the spine's facet joints, discs, ligaments, or muscles. Compressive pain is irritation or pressure placed upon the nerves, most likely due to ruptured, herniated, or bulging discs. If you have low back pain, it is important to visit your physician for a proper diagnosis in order to determine the type of pain you may be experiencing. The physician can then recommend appropriate treatment.
And we will be right back with more Ask Dr. Zach.
up next,
Blue and red tags.
I've
up
always
next.
had back
A
issues.
young mother picks up her toddler. Text back
Post-pregnancy,
pain, back
they've
with a
come back with a
vengeance.
vengeance.
We see her in various rooms with her child. Blue and red tags. Ask Dr. Zach. A white hospital corridor with a graph of a heart monitor and red on the walls. Text reads, Ask Dr. Zach. Exterior of a condo. A woman sits at her computer, her toddler on her
Post-pregnancy,
lap.
I've been getting
Text
a lot of
back
back
pain,
issues,
back
with
with a
lower back
vengeance.
issues,
Yashi Murphy,
sciatica,
age 35.
and obviously trying
She's shown on
to
a couch with her
exercise or
active
go
daughter.
back to
And
getting
in the
active.
kitchen,
We
and
haven't
then
been
she
able to
points
really
to where she has
find a
pain in the lower
solution
back.
because the doctors haven't been able, they just keep telling me to exercise and strengthen the back with exercise.
She's worn out.
It's this portion that hurts, and then obviously down here for the sciatica. And the shooting pains are in the front, lower abdomen area. Oh, Cinderella, did you lose your shoe? I've always had back issues, but they disappeared during pregnancy. And post-pregnancy, they've come back with a vengeance. It affects me from a daily living perspective because we are out and about. We live in downtown Toronto. We don't own a car. We walk everywhere. When we go out to festivals or events, I'm constantly looking for places to sit down for a bit. What shape is this?
It's a triangle.
Okay, so then it'll form a triangle. I've been trying to do a couple things. Lots of back exercises with tennis balls. I was doing yoga for a bit, Zumba lessons, but the Zumba is actually hurting me more than helping me. I am concerned about what will happen in the future because it seems to be getting worse. So my gut tells me, no pun intended, that there is some other issues at play, and I would love to hear Dr. Zach's opinion on how I can get better and stronger as far as my back's concerned.
now it's time to ask Dr. Zach.
And thank
In
you
the
very
studio,
much for
sitting
joining
at
us,
his desk,
Yashi.
Dr.
Thank you for
Zachary
having me.
Levine
It's
has
a pleasure.
Yashi
So,
Murphy sitting before
you tell
him.
a story that I think will resonate with a lot of people. I think a lot of people suffer from back pain, and certainly related to pregnancy. Some people it gets worse in pregnancy. In your case, it got better, but now it's
Yeah.
worse.
Yes.
How has your back pain evolved since you gave birth?
It disappeared for a good 2 years between the two pregnancies, but now it just keeps getting worse.
Have you noticed what brings it on in specific activities?
Just walking a long time, standing, cooking, complex dishes, yes.
Yeah. And you mentioned you also get sciatica type pains, eh?
Yes, and that's shooting pains
Yeah.
mainly on the left side,
Okay.
and that's happening more frequently as well.
But something a little unusual is that it radiates around to the front, you were saying.
Yes.
And is that all the time? You always get them at the same time, or not
It's
necessarily?
honestly, this week in particular has been worse, and I'll get it at least a couple times, like 3 or 4 times a week, especially if I'm lying down, if the kids jump on me, or if I'm lying, sleeping and try to flip, I get shooting pains in the bottom.
There's a few things. Number one is if it's persisting a long time, which it is, and it's not getting better, even though you're doing all the things you need to be doing. So again, you really have to make sure you're optimizing the exercises and the stretching and the strengthening, and make sure that someone gave you the right kind of exercises to do. Because sometimes people can do, some exercise. The doctors say, oh, okay, exercise. People will do it for a year, but they're not actually doing what's going to help their back. So by strengthening the muscles and the ligaments around the spinal cord, it takes some of the strain off the actual spinal cord and the discs and the vertebrae, and that can be quite helpful. But again, you need a specialist to tell you the kind of exercise to do, like a physiotherapist. If necessary, sometimes medications are useful for a brief period of time, at least to control the pain and or to control inflammation. And that can be either topically, like sometimes there are some rubs you can put on just to relax the muscles. There's pills you can take that are just like acetaminophen, which is also known as Tylenol for the pain, or anti-inflammatories. If things are persisting and you're really not really sure what's going on, then the next things to do would be further imaging tests. And I'm talking about really the best imaging test to look at the spine and the spinal cord is an MRI. If there's a question of whether it's something else, like something, because sometimes back pain is actually radiating something in the abdomen or the pelvis that's radiating into the back.
Yeah.
And so that's something you may want to discuss with your doctor. Could it be something else? In which case, testing would actually be different. They would actually be, aside from a physical examination, your doctor would check you out. I'm sure they already have.
Yes.
They would also want to do things like a blood test and or a urine test, possibly an ultrasound and or a CAT scan, that sort of thing.
Okay.
So all those things are possible treatments for you.
Okay, thank you.
Red and blue tags ask Dr. Zach.
Now,
the
Dr. Zach's prognosis.
Dr. Zach stands for a monitor showing
So Yashi
positive
came to us
medical
complaining of
animation
lower
the
back
human
pain, which
spine.
has been ever since she had her last child. Now, there are a couple of issues there. Number one, she is very active, which is important, but she's lifting her kids all the time, which probably isn't helping her lower back. The real issue here is Yashi has had trouble losing weight from her last pregnancy. It's very common, but there's no real getting around the fact that she needs to lose weight and she needs to be physically active in order to improve this. So she needs to eat less calories than she expends, do a lot of exercise, and strengthen her core muscles. So that means her back muscles and her abdominal muscles. And she'll find over time that this will definitely improve the pain that she has in her back.
Now it's time to ask Dr. Zach about a disease still feared and misunderstood by many people, mental illness.
Mental illness is a common issue that affects a lot of people, with some experiencing major depression. It's associated with an increased risk of other illnesses like stroke and some forms of cancer, and one's risk of mental illness is increased by having physical illness like heart disease. Having a mental illness does increase the risk of suicide, but good treatments are available. To learn more about mental health, let's take a look at this amazing Blausen medical animation.
Dr. Zach looks at a monitor beside
The
him
brain
which
is
displays
composed of
Blausen
millions of
medical
interconnecting
animation
nerve
of the human
cells called
brain,
neurons.
showing its neurotransmitters
In order for a
and
person to think,
neuroreceptors.
move, or feel, these neurons must communicate with one another. They do so by sending and receiving chemical messengers called neurotransmitters. When a neurotransmitter is released from a neuron, it crosses a cleft or synapse and binds to a receptor on another neuron. Thus, the signal is passed on. Unlike the blues, sadness, or even grief, depression is a condition in which a person feels an overwhelming and debilitating unhappiness. People who are depressed may have trouble thinking clearly, and be unable to perform normal functions. They may be uninterested in eating and be unable to sleep, or they may engage in these activities excessively. Persons with depression may even have thoughts of suicide. Although depression can be triggered by an emotional event in a person's life, a decrease in the levels of one of the neurotransmitters, serotonin, has been linked in the biology of depression. There are many forms of depression. Therefore, it is important for a person who may be depressed to see a doctor who can accurately diagnose the depression and prescribe appropriate therapy.
And we'll have much more on Ask Dr. Zach after the break.
Tex up next. Everyone practices
next.
yoga. Tex, mental health, battling
I get night
PTSD.
terrors,
Then she sits
where I
in a
have
colorful
flashbacks in
room.
my dreams about circumstances that happened when I was a child.
All this and more right after this short
Dr.
break.
Zach. A white hospital corridor at the graph of a heart monitor and red on the walls. Text reads, Ask Dr. Zach.
I'll bring it up.
Exterior of a red brick
exhale.
ranch-style home. Inside,
I
a
have
blonde
suffered
leads
from
a group of
post-traumatic
women in a
stress
yoga
disorder,
class.
as
She's
well
Lori
as
Williamson,
depression
age
since
44.
about the age of
Text,
13.
mental
I was
health,
sexually
battling
abused by 3 trusted men in my
PTSD. Lori
home.
continues
You
to
can have
instruct
really
the
low
women through
days where
various
you feel
yoga
tired,
poses.
lethargic, not thinking clearly, feeling negatively, not able to cope or express your emotion very well. I get night terrors where I have flashbacks in my dreams about circumstances that happened when I was a child. Okay, so inhale and exhale, sink a little bit lower in the front leg. One of the most healing things that I can say I've done in my life is be able to help other people that suffer from mental illness and depression, and by being a yoga teacher, I'm able to help people in that position. I think it's a daily struggle for everybody. You've got to go through the storm in order to get to the other side.
Outdoors with her class, Lori does a yoga pose on the pool diving board
In my
and
life, I
dives
try
into
to
the
create
water.
a very positive environment, something very healing. I have my studio here. I have the pool, which has been such a pleasure, as well as the trampoline.
She and the young girls bounce on a trampoline.
It's a place to congregate with family and heal. I'd be really interested in finding out Dr. Zach's approach to treating my depression after seeing a few medical specialists over the years. It'd be nice to get a different opinion, or if there's any better suggestions he might provide.
Now it's time to
Tex,
ask Dr. Zach.
In the studio,
And welcome,
Dr.
Lori.
Zachary
Thank you so much
Levine
for being
sits at
here.
his desk
Thank
with
you for
Lori
having me.
Williamson
And thank you very much for sharing your story. And I'd like to know what you found that has worked for you.
So far, I found meditating, yoga, my faith, as well as exercise really helps with the effectiveness of the medications.
Absolutely. And just for people who don't know what PTSD is, you've been exposed to something very traumatic in your life. Either you or even sometimes people who have witnessed something very traumatic.
Yes.
And it results in very significant mental distress. People can sometimes have flashbacks, they can have avoidant behaviors, they can have mood changes. And as you mentioned also, it can be associated with depression and other things, including eating disorders and anxiety. So it's certainly a lot to deal with. And there are different schools of thought of how to treat it. From the medical model, there's sort of two approaches. There's the therapy, and that's certainly considered the first approach. And then there's the medication aspect. And both are considered useful. But what I like is what you brought up is that there's a whole bunch of other things that are synergistic with the therapy and with the medication, like exercise, like yoga, like your faith. And sometimes it takes a while to determine what works for you specifically. And I think one of the important things is that you're coming on to the show and talking about it so other people know that there are other people who experience it. And it's also very helpful for people to meet other people who have experienced it and talked about what works for them.
Definitely.
Have you met anyone else who's experienced it? Have you worked with others in the same situation?
Thank you for asking. Yes, it's actually become my passion in life to work with people that suffer from depression, post-traumatic stress disorder. I bring a lot of people into my studio and we basically let it all out on the mat.
And studio, is that yoga?
Yes, it is.
Okay, so that's great. And you've found that it's been very helpful for people?
Very helpful.
Yeah.
There's strength in numbers.
Now, some of the other symptoms I'll just bring up, for depression specifically. So I think everyone thinks of low mood, feeling really sad. But there's a lot of other symptoms like loss of energy, loss of appetite, lack of sleep or sleeping a lot. Actually, and some people eat more, some people eat less. And in fact, some people will self-medicate, like with alcohol or with drugs, to try and make themselves feel better and or to forget what's going on. Mm-hmm. Now, if you don't mind me asking, did you experience any of those kind of symptoms?
I would say almost all of the above. Sleep has been an issue. Sleeping not enough, being woken up by bad dreams, as well as consuming more alcohol than I normally would have. Yes, definitely.
Yeah. Now, do you consider it a chronic, day-by-day process? I mean, do you feel like you're always kind of dealing with it and have it under control?
You're certainly aware of it on a day-to-day basis. I think every day you try to do your best and I guess not put your feelings aside, but cope with the feelings, address them. You have to go through the storm to get to the other side.
Absolutely. Now, how about therapy? Have you engaged in any kind of therapy?
Yes, over the years I've gone for psychotherapy as well as I've gone to group therapy. Mm-hmm. Yeah.
One other thing that a lot of people do benefit from, it's certainly not the first element in treatment, but is medications. And so there are a number of different medications used, specifically depending on what the symptoms are. So if there's a lot of anxiety, if there's a lot of depression, there are medications specific for those. Have you found any medications helpful for you?
Right now I've been taking Prestique. It's been a 3-year medication for me. Mm-hmm. I found it's very effective providing I stay away from alcohol, get enough sleep, eat a balanced diet, and am getting my exercise in.
Absolutely. So, and that's a perfect explanation to people, because medication can be very helpful for people, but really it works synergistically with the rest of the lifestyle. Really, medication's not enough. And so usually people need to have a whole lifestyle change, plus or minus medication. Now, you have a lot of very important information to share, experiences and also know-how. And so I really think you could really write a really interesting book. And I hear you might be doing just that.
Yes, I am currently writing a book. It's called Grief to Gratitude. It's focusing on my journey up until this point in time, taking me through, and I find the biggest thing I can find that helps me is when I focus on my gratitude, it helps me get through my days.
Red and blue tags, ask Dr. Zach.
Now, Dr. Zach's prognosis.
Dr. Zach stands before
Gloria
a monitor
suffered from
showing blast and
PTSD
medical
and from
animation of the
depression
human brain.
because of traumatic events that occurred when she was very young. Now, she hasn't let that define her, and in fact, she lives a very meaningful life. She's very active, and she's also engaging in cognitive behavioral therapy. I think her outlook is very good because she maintains a very positive outlook, and she's very active. And she's not letting this control her or define her. And also, she's using her experiences to help other people.
Don't go far. We'll be right back with the doctor's orders.
Red and blue text, ask Dr. Zach, doctor's orders. Dr. Zachary Levine speaks
Doctor's
directly
orders,
to camera.
fight for your rights. Ageism in healthcare is a fact. Healthcare professionals tend to be less aggressive in their treatment of older adults, but the problem is there's no intrinsic value to a number. There are 80-year-olds who are very healthy. There are 50-year-olds who are not healthy. The important thing is to have a doctor who knows you and knows what you want for your treatment. When you go in, go with an advocate. Fight for your rights.
Now it's time for you to ask Dr. Zach.
Now is the time of the show when the audience asks some questions. So first question, please.
Yes, hi, Dr. Zach. My name is Chris. I'm an engineer, and I wanted to ask you about a hernia that I had, or I have. I guess it's called the hiatal, is it?
Yeah, hiatus hernia.
What's the success rate of repairing it?
The hiatus hernia is when there's a little opening in the diaphragm, which is the muscle layer between the chest and the abdomen. And the problem is, some people it doesn't cause any problems, but the problem is that sometimes this causes the stomach, the esophagus is usually in the chest and the stomach is just on the other side. But in some people, the stomach actually creeps up through the hole, and this can give people symptoms. So pain or difficulty swallowing, a lot of burping. And if the stomach's ever really stuck, then they have to do it emergently, but usually it's not emergent. And the good thing about the surgery is they can do it endoscopically. They don't have to do a big cut anymore. They can do with small cuts and the cameras. The success rate is very good, so we're talking about near 100% success. However, the recurrence rate is about 4%. 4% of the time it does recur, and people end up needing to have another procedure potentially. But basically it's general surgeons who do that kind of surgery, and there are some general surgeons who specialize in doing things in a minimally invasive way, endoscopically. Thanks for the question. Next question, please.
Hi, Dr. Zach. My name is James, and I'm a referee. I had a Morton's neuroma surgically removed 2 years ago, but it was never fully explained what caused it or how to prevent a recurrence.
Okay, good. So Morton's neuroma, as you know, and some people don't, it's a buildup of some of the soft tissue on the foot, usually between the third and the fourth toes, around the area of the nerve, and it can get quite painful. And usually people describe it sometimes as having like a rock in their shoe constantly that's always pushing between the two toes.
Right.
And in terms of, some of the treatments, you had one of the treatments with his surgery. Other ones include injections. Some people will have injections of steroids to try and decrease the inflammation. It's much more common in women, actually. So in women, not you, I always say, stop with the high heels. I'm not a fan of the high heels. And high heels are one of the biggest causes of it. Other causes of it that may be more applicable to you, obviously, would be tight shoes. So maybe you don't do that, but that's just one of the risk factors. And high impact sports can put you at increased risk for it. If you do have tight shoes, so now you're not, I can see your shoes, you're wearing running shoes. Those are good, they're supportive, they have good cushioning. People who wear shoes like mountain climbing shoes, those are the types of shoes that are known to be somewhat potentially a problem with Morton's neuroma.
Okay.
Aside from that, some people find that getting an insole helps, or even a foot pad in the front that gives them a little more cushioning. And then if you find, the other thing is trying to find a trigger in terms of what brings on the pain. And even if you want to continue to do that though, at least you know the trigger, you can work with your doctor on ways to prevent the pain associated with it.
Okay, thanks.
Thank you. That is all the time we have for today. Thank you very much for watching. I want to thank the guests for coming on. I want to thank the people in the audience for coming and for asking great questions, and I hope they had some great answers too. And be sure to join us next time on Ask Dr. Zach.
Post-production manager Ken Greenberg, production coordinator Brandon Ackerley, technical director Greg Fernandez, writing director Greg Krause, co-director Darian Kovic, FAH audio John Barry, audio producer Patrick McCarty, studio producer Han Darren Maharaji and Lee. MZ TV production and distribution 2016.